Okay, hi, it's Dr. Buford. We're just getting started on the right knee. We're looking in the medial compartment now. That instrument you see is called a shaver. And we're going to start by looking at this posterior horn. That looks good. The tear is right here. A little bit hard to see right now. Go up another 5 on the pressure to 55. Got it. So, she got it. She got it. So the tear is right back at the base there. But it looks like this anterior horn is intact. There's a little bit of fraying on the cartilage here, but the tibial plateau looks good. So we're going to have a peek at the ACL next. I examined your ACL before we started, and your knee was stable. So if we have some extra PRP, we can certainly inject a little bit of a partial tear that you have, but we don't need to do a major ACL reconstruction today. Here's the graft not the graft. Here's your ACL ligament right here. You see it looks pretty good. This tissue right in our face is called the ligamentum mucosum. We're just going to remove that so we can see. There, now we can see better. And there's a couple little signs of partial tear. You can see this little area here. But that looks pretty good. So next we'll look in the lateral compartment. Okay, so this is the lateral compartment. This compartment's in pretty good shape here. And I really don't see any significant problems here. There's a little bit of thinning of the cartilage down below on the tibia, just below the shaver there, but that looks pretty good. And we'll show you some more in a minute. Okay, so here's the patella at the top of the screen. That's your kneecap. That looks great. The trochlea is this groove that the patella glides in, and it's just below the shaver here. We can track it all the way down the front of the knee like that. And it looks pretty good also, so that's encouraging. We'll look around here a little bit more, but so far so good in terms of what we're seeing in this part of the knee also. Okay, so there's the one stitch. It looks good. That meniscus is stable, and we put it right bracketing the area of the tear on the MRI scan, so I'm happy with that. Okay, what we're going to do now is pass our PRP right at the meniscocapsular junction, basically right there, kind of right above the tear as you see. Pause. Okay, we're injecting right now. We'll just see if we can watch. And it took a good 4 cc's back into the capsule there, so I'm happy with that. So we're going to have one more look around, and then we're going to finish up here. Good luck to you now. Bye-bye.